I tend to believe that augmentation that's not exaggerated complements you, and get a size that complements your body so that it doesn't look unmatched. So the question is, what's your best option for breast augmentation, saline or silicone? It's really a choice thing. Both of them are great options for a patient. It all depends on the look you want and also the feel of it. Saline is natural in the sense that we're just saline inside. So in the case of, unfortunately, like a ruptured, you don't have to worry about anything as far as bad reaction to your body, because it's just fluid that's there. All we have to do is take out the capsule and put another one. With a silicone implant, there are different options. You can do a gummy bear, you can do high profile, you can do a more wide selection. So you get more variety with it. It's very soft, it's very natural, and the risk of rupture is very, very minimal. So you don't have that risk with this newer generation silicone implant. I really customize it to the patient and ask them what is it that they want. I know there's a lot of information out there with silicone implant and the scare, but it's still a very great option for a woman. But with the breast augmentation, I really just tell my patient wearing some sort of soft, supportive garment is all you need. Whether it's a sports bra that's not too compressive, just something to give you a support. That's all you need. And then doing some exercise. I go over some little exercise routine with my patients to do post-breast augmentation. That really helps the implant settle and also makes you feel better. So the question is, are breast implants safe? The overwhelming answer is yes, they are safe. They've been tested and proven over time, and it's something that millions of women have had it done. So it's still a very safe procedure to choose if you want for yourself. Capsular contractions, so long as you have breast augmentation, it can happen. Even after we go in, improve it, take out the scar during tissue and put a new implant, it can still happen. And you really don't know if you're gonna have it or not. It's not something that a surgeon can predetermine, like, oh, you're gonna have a capsular contraction. It just happens. When you have scars with breast augmentation, the answer is yes. They're very short scars, and it all depends on the technique. So if you do below the breast, your incision is about this much. It's not that long at all. And it's well hidden. So even when you're nude looking at your pictures, you can't really see it because it's right there in that breast fold. How can I get more natural results from a breast implant? The beginning stages of augmentation at first is just assessing the breast and seeing how the breast texture or the architecture of the breast is. If there's some sagging or something else that needs to be done, it's very useful. So the whole idea of getting a natural breast really determines where you are before. I tend to believe that augmentation that's not exaggerated complements you, and get a size that complements your body so that it doesn't look unmatched. So I think implant selection to the body frame is really important to maintain that natural look. Can you breastfeed with breast implant? Yes, you can. Because of how breast implant is inserted into the breast tissue, it doesn't distort the breast duct. So breast milk can still form, you can still breastfeed, you can have a mammogram after a breast implant, and it doesn't alter any of that. How long does breast implant surgery last? It could be forever, or it could be as long as you want it, so long as you're not having any issues with it. My general advice to clients is that once you've had your breast augmentation, if you're doing great, that's it. You don't need to worry about it coming out. I know there used to be this information, after 10 years, you should take it out and put another one back in. You really don't have to. If you're doing great and you're not having any issues, just keep it and keep going with it. What's the recovery time of breast augmentation? 1 to 2 weeks. Usually 2 weeks, you're fine. You're back to yourself. But really, after the procedure, the next day or so, you don't really have to worry about much. You can go back to most of your activity, but in about 2 weeks' time, you're good to go. Is there a risk of breast cancer after breast augmentation? There is a concern with the silicone implants having a small risk of this type of cancer, but the current generation of silicone implant has really improved that, so it's not something that's commonly concerned with, but it's a very small risk.